To start out, I think we all recognize that infectious disease remains among the top transnational challenges facing populations today. And infectious diseases impact lives, livelihood, the movement of people and goods, and at times, overall social structure and governance. Think of the recent experiences with Ebola in West Africa, which is ongoing in the DRC. Think of the disease that emerged in my lifetime, HIV, and its impact on families, communities, and economies. As we've all experienced, infectious disease can quickly evolve into a global emergency that requires a coordinated global response. And while there has been tremendous progress designing tools to prevent and cure many diseases, the emergence of new diseases and the reemergence of diseases once thought to be controlled are the result of a complex and globalized world in which we live. The Global Infectious Disease Program recognizes today's reality, in that combating these diseases requires the ability to effectively communicate and coordinate amongst decision makers from multiple disciplines. The program addresses the complexity of working in this space. It recognizes that combating diseases requires a range of tools, including designing preventative technologies and approaches, development and deployment of effective therapeutics, advanced computational modeling for predicting and surveilling disease transmission, and strong supporting international and national public health policies focused on improving health. Therefore, the design of this unique program was undertaken across the entirety of Georgetown University, and I think you are all sitting in this room today, including the college, the Graduate School of Arts and Sciences, the medical school, the School of Foreign Service, and the law school, led by my colleague, Professor Steve Singer, and the director of the Global Health Science and Security Center, Rebecca Katz. They designed a fit-for-purpose design that paralleled the multidisciplinary training needs of our future infectious disease leaders. The program will provide candidates with the ability to understand and communicate across a complex set of disciplines with the support of cutting-edge research and evidence to effectively respond to infectious disease, including understanding the international health regulations, frameworks, and conventions, understanding biomedical advancement and their appropriate and ethical deployment, and the ability to apply analytics and computer modeling to predict outbreaks, disease spread, and anticipate the impacts of different interventions. With the emphasis on the intersection between policy and biological sciences, the Global Infectious Disease Program has two concentrations: policy and disease modeling. It is the only master's level program in the United States to offer an opportunity to train in infectious disease modeling. So whether it be the decades-long response to the global HIV pandemic, fighting immediate outbreaks, research to understand the impacts of Giardia on childhood nutritional status, or negotiating the details of international governance related to infectious disease, the Global Infectious Disease faculty have been on the leading edge of their response, providing deep experience across many departments and agencies of the United States government, public health implementing organizations, the private sector, and philanthropy. The 18-month Global Infectious Disease Program at Georgetown offers the ability to have real-life lab in your backyard, to engage with the US and international decision makers, and contribute to the Georgetown community of scholar practitioners working in global infectious disease.